Hey there, welcome back to the Rustic Shaman. Do you know the differences between health insurances? If you've ever found yourself overwhelmed by all the different health insurance options out there, you're definitely not alone. In today's video, we're breaking down the main types of health insurance plans, HMO, PPO, EPO, POS, HDHP, and more, in simple terms so you can make the best choice for you and your family. Let's dive in. First up, we have HMO, or Health Maintenance Organization plans. If you're the kind of person who likes a bit of structure, this might be a good fit. With an HMO, you're required to select a primary care physician, or PCP. This doctor is kind of like your healthcare gatekeeper. They'll handle most of your care and give you referrals if you need to see a specialist. The pros: HMO plans usually have lower premiums and out-of-pocket costs, making them budget-friendly. The downside: you're generally limited to a network of doctors, and you'll need a referral to see specialists. Out-of-network care usually isn't covered unless it's an emergency. Next, let's talk about PPO plans, or Preferred Provider Organization plans. These are great if you want a bit more freedom. With a PPO, you're not required to choose a primary care doctor, and you can see specialists without needing a referral. Although optional, a primary care doctor is recommended for getting full medical care. This is especially important with certain types of treatments and medications. On the upside, you get more choices and flexibility with PPO plans. You can see any doctor you like, but you'll pay less if you stick to the plan's preferred network. The trade-off: you'll generally have higher premiums and out-of-pocket costs compared to an HMO. And now let's look at EPO, or Exclusive Provider Organization plans. Think of EPOs as a mix between HMO and PPO plans. You don't need referrals, but you have to stay within the network except for emergencies. So EPOs often have lower premiums than PPOs and offer a good balance of flexibility and affordability. But remember, no out-of-network coverage, so make sure the network has all the doctors you want before choosing an EPO. I do not recommend an EPO if you travel a lot and have health problems. POS plans, or point-of-service plans, are up next. These plans require you to choose a primary care physician, like an HMO, but they also give you some out-of-network options like a PPO. POS plans give you a little more flexibility than an HMO, but the trade-off is that premiums and costs can be higher. Referrals are needed to see specialists, so if you don't mind coordinating through a PCP, this plan can work well. Now, for high-deductible health plans, or HDHPS. These are designed for those who are looking for lower premiums and are okay with a higher deductible. HDHPs are often paired with health savings accounts, or HSAs, so you can save pre-tax dollars for medical expenses. The major advantage is lower monthly costs, but you'll need to pay more out of pocket up front until you reach that high deductible. These plans are great for healthy people who don't need frequent medical care, but want to be protected against big unexpected expenses. However, I would be wary of these types of plans. You never know what your body has in store for you, and you could be deep in debt fairly quickly. Let's also touch on catastrophic health insurance. These are basic plans with very low premiums and high deductibles, usually available for people under 30 or those with financial hardships. Catastrophic plans are really there for worst-case scenarios, so you'll have to pay most of your routine expenses out of pocket. But in an emergency, you'll be covered after meeting the high deductible. I do not recommend these plans unless absolutely necessary, as they leave you with very little umbrella. And finally, we have Medicare and Medicaid. Medicare is a government plan for people aged 65 and older, or those with certain disabilities. It's divided into parts that cover different types of care, like hospital, outpatient, and prescription drugs. Medicaid, on the other hand, is a joint federal and state program for low-income individuals and families. Eligibility and coverage options vary by state, but it's designed to provide comprehensive care for those who qualify. Alright, so now that we've covered the basics of each type, let's talk about choosing the right plan for you. Think about your healthcare needs. Do you have specific doctors or specialists you want to keep seeing? Are you on a budget, or do you need flexibility? And don't forget to check for any specific healthcare services or medications you rely on. Those can make a difference in which plan works best. And there you have it. Health insurance doesn't have to be confusing, and now you're equipped to make a more informed choice. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more tips and breakdowns. Have questions? Drop them in the comments below and we'll help you out. Thanks for watching. We'll see you in the next video.